Hello everyone, today we are going to be talking about the normal and abnormal appendix and what happens when a patient is diagnosed with appendicitis. So we're going to be starting off with the normal appendix. Here's a picture of it in long. The preferred modality for checking for appendicitis would be CT, but due to the radiation they start with ultrasound to lessen the radiation for the patients. It can be difficult to see on ultrasound, but when scanning, you should use a small parts probe and scan in the right lower quadrant at McBurney's point. McBurney's point is if you were to stretch out your hand and place your thumb on your iliac and your pointer on your belly button, it would be right there in the middle. So it's following the ascending colon and the right iliac, so you just want to scan in the right lower quadrant to look for it. Again, it can be difficult to see due to gas in the bowel and some peristalsis in the bowel. But if you were to find it, you would want to measure the width, the length, and the wall, just as you would the gallbladder. The width should not be any more than 6 millimeters. The length should not be any more than 9 centimeters, and the wall should not be any more than 2 millimeters. If it were, then that would be an indication of appendicitis. Also, you should use color Doppler. There should be low vascularity for a normal appendix, and the layers should be distinctly seen, as you can see here, as some homogeneous layers. Now, Brittany's going to talk about the abnormal appendix.
So an appendix can be abnormal for many reasons. The basic one is appendicitis. Your walls are going to be inflamed greater than 2 millimeters, which is going to be right here. Similar to a gallbladder, you've got that thickened wall. And then in transverse, it'll look like a bullseye right here. So you've got your little bullseye appendix there. A symptom of a appendicitis is edema. Another reason you could have an abnormal appendix would be a perforation. You're going to have asymmetrical wall thickening, free fluid, and inflammation in the surrounding tissues. Another reason you could have appendicitis is a mucocele. It's grossly inflamed, and it'll be anechoic with fluid surrounding the tissue, and it's an indication of cancer.
Oh, the pain! The fever! I can almost see. Quickly scan me! I need help! I don't know if I can make it. I'm about to poop myself! Oh, the pain! It's my burning point! I can't make it! Perforating! Exploding! No!
Take a look at your right lower quadrant using a small parts probe.
Let's have a look with ultrasound. We have the thick-walled, dilated appendix, just as we saw on CT. We can also see evidence of the fat stranding seen on CT, as the mesenteric fat appears diffusely echogenic. But there are even more things to note with ultrasound. As ultrasound is a dynamic test, you can also look for compressibility and for peristalsis. The absence of both of these features further suggests appendicitis. Color Doppler assessment allows you to look for hyperemia, which is another useful supportive feature. In this example, we can see that the submucosa, although echogenic, is intact. Here's another example of appendicitis on ultrasound. Again, we have a dilated, thick-walled appendix. This time, there is a discernible fat wrap of inflammatory tissue. As we continue scanning, we see a defect in the wall of the appendix. There is also some surrounding periappendiceal fluid. These findings are suggestive of a perforated appendix.